Dr. Baliga here. I have another terrific podcast for you, the Must Know EKG podcast. You'll find this podcast educational, like all other podcasts in this Must Know EKG series. This podcast is derived from EKGs available at mastermedfacts.com. A 66-year-old school teacher complains of palpitations. An EKG done shows the following EKG. The most likely diagnosis is 1. Sinus tachycardia, 2. Atrial tachycardia, 3. Ventricular tachycardia, 4. Tachycardia arising in the bundle of His. And the answer is choice 2, atrial tachycardia. The P wave is inverted in leads 2, 3 and AVF and chest leads V3 to V6, suggesting that the arrhythmia originates outside the sinus node and in the atria. Atrial tachycardia happens when a site outside of the sinus node but within the atria creates action potentials faster than the sinus node. This ectopic focus becomes the predominant pacemaker of the heart. When the atrial rate is greater than 100 beats per minute, the rhythm is atrial tachycardia. Typically, the heart rate is between 100 to 180 beats per minute. The narrow QRS complex suggests that the origin of tachycardia is not below the atrioventricular node. Atrial tachycardia is an uncommon form of supraventricular tachycardia and is caused by multiple mechanisms. The arrhythmia may be due to abnormal automaticity from one or more atrial loci, triggered rhythm, or atrial re-entry. There are several algorithms to decide whether the atrial tachycardia originates in the left or right atrium. One such algorithm was published in the Journal of the American College of Cardiology in 1995 in an author co-authored by Dr. Tang et al. It's available open access. Essentially, the algorithm starts at lead AVL, and if it's upright or not. If it's negative, like in this EKG, then it's most likely to be right atrium in origin. And then if it's negative in the inferior leads 2, 3 and AVF, then it's most likely to be inferior right atrium. The right panel shows the figure of a schematic figure of the heart so that one can visualize the right and left atrium and the origin of these atrial tachycardias. A P-wave algorithm has been constructed by another group of authors, which also came out in the Journal of American College of Cardiology in 2006, and they correctly localize the focus in 93%. What is ripe for research is using big data sets and machine learning to improve the ability to determine the origin of these atrial tachycardias. This is an EKG of a 44-year-old school teacher who complains of palpitations, and this EKG is courtesy from Dr. Joe Marine, who is the vice chair at the Division of Cardiology at Johns Hopkins. And again, on this EKG, you will see that the P wave is negative in the inferior leads and in many of the chest leads, suggesting atrial tachycardia. Left atrial rhythm is characterized by left-right spread of atrial depolarization. The most frequent EKG pattern of this rhythm consists of upright or isoelectric P waves in lead 1 and inverted P waves in V6. A negative P wave in lead V6 is the most sensitive and, in the absence of atrial inversion, the most specific sign of left atrial rhythm. Frequent appearance of inverted P waves in leads 2, 3 and AVF in the left atrial rhythm necessitates the establishment of criteria for differential diagnosis of nodal arrhythmias. For those who are interested in more about P wave configuration to predict the site of origin of the atrial tachycardia, this is one of the seminal papers which came out in the Journal of American College of Cardiology in 1995. This concludes this Must Know EKG podcast. Follow me on Twitter at RR Baliga, MD.